Good afternoon, everyone. I'm Ainol, UOUM student on Master of Occupational Safety and Health and Risk Management. I would like to present a research proposal on the occupational health hazard among healthcare providers, a study in KPJ Seremban Specialist Hospital. Background of this study is healthcare industry is providing a provision of health services directly and indirectly to an individual. As everyone knows, healthcare workers are prone to exposure of serious safety and health hazard in their working environment daily and every day. The hazard include the bloodborne pathogen, ergonomic hazard, physical hazard, workplace violence, radioactive materials, and also radiation hazard. The impact of the hazard that faced by the healthcare workers can lead to the serious health problems such as mobility, mortality, uh, also can be infected by the serious illness such as HIV, hepatitis C. Okay, in this study, I divided the problem into two category: biological hazard and non-biological hazard. Biological hazard were defined anything incidents to include cut, wounds, laceration, sharp injury, direct contact with the contaminated specimen, biohazardous material, bloodborne pathogen, infectious disease, airborne disease, vector disease, and also cross-contamination from the soil material. For non-biological hazard were defined to include physical, psychosocial, ergonomic such as back pain, and also carpal tunnel syndrome. Statement of the problem: there are various studies conducted in the occupational hazard separately, but very limited study found with related to the occupational hazard in healthcare as a whole. The study attempt to close this gap, bringing to giving a clear understanding of the occupational hazard among healthcare workers, the most prevalent in the capstone, including what is the influencing factor and hazard prevention in reducing an occupational health. The research goal are to study, to examine the most prevalent of occupational health hazard in KPJ Seremban and hazard prevention in reducing the risk. Objective of this study are two. One, aim the most prevalent occupational health hazard among healthcare workers in KPJ Seremban. Second, to analyse and establish prevention in reducing the risk of occupational health hazard. In this study, they are guided by a few occupational questions such as: to what extent the most prevalent occupational health hazard affect the employee performance, such as their absence, their number of NC, their LTI, loss in the time injury, and to what extent of the hazard prevention has been established. To look in this question is to look in KPJ Seremban, what is the hazard prevention that has been established and how effective of the hazard prevention. It's also to what extent what's the effectiveness of the hazard prevention strategies reduce the occupational health incidents. These three questions will guide the research in KPJ Seremban. The study focus on the healthcare industry. The scope of the study proposed to conduct in my workplace, KPJ Seremban. The study is target on the 600 nurses, consultants, 600 staff, which consists of consultants, nurses, help, such as pharmacy staff, physiotherapy, diagnostic and laboratory staff. The study was planned to conduct next year, 2020. Then, in this study, I quote a few literature review, which I will present one by one. A little review on the literature which has been conducted worldwide. On the needle stick surgery, which done by Sharma on 2010, studies on the prevalence and response of the needle stick injury among the healthcare workers. The result shows that 79.5% or equal to 256 of healthcare workers is reported having at one of needle stick injury in their career. and maximum are among of the nursing students, 94.2%. From the 45 respondent, or equal to 17.6, reporting having needle stick injury involving a high-risk patient. A high-risk patient is defined as a patient with history of HIV, hepatitis C, hepatitis B, in their history of disease. Not wearing glove also is one contributing factor identified in the study, which equal to 27.3%. Okay, on the sharp injury, the study is more wide on the sharp injuries incidents, which include a few less such as equipments, uh, glasses, whereas sharp is on whereas needle stick only study on the needles injury. Okay, Huang 2017 has studied on the sharp injuries among healthcare workers. It's reported that a total of 18,344 sharp injuries were reported out of 223,149 participants, is equal to 8.2%, or equally 8,221 cases per 100,000 healthcare worker in a month. This is assessed as a very, very huge numbers of incidents. Okay, with work-related noise in the hospitals area or healthcare area, Monique 2001 studied that noise in the hospital setting, the impact of the quality life. The studies shows that the noise in the hospital levels was very high. It's about 57.2 to 80 decibels, whereas WHO recommend noise in the hospital levels only not higher than 40 decibels during a day and 35 decibels during a night. Verbal abuse. Verbal abuse that is studied by Sival 2019. Verbal abuse among the nurses shows very prevalence, which 36.9 among nurses in the hospitals are have abuse. Most of the contributing factor that abuse is the relative patients. Work-related stress. Stress is everyone having it in the occupational health. Is not essential in the health. Also, nurse-related stress has been counted as one of the occupational hazard. Studied by Bhatia 2010, a large percentage of nurses reporting stress, about 87.4%. And then their extremely stress is, the age is about 30 years and above. Okay. And out of that, 1% of the nurses who have been stressed reported a feeling suicidal. This is a quite dangerous situation. Low back pain. Low back pain is a common occupational hazard among nurses and healthcare workers. Study by Dushwain 2018 shows that 49% of the respondents having a low back pain, which is in obstetric and gynecology ward. These factors of contributing occupational low back pain due to bending, twisting, prolonged sitting, transferring patient, pushing and pulling are the stronger factor identified. Carpal tunnel syndrome is another one of the ergonomic problem in the nurses, where all those activities also contribute the carpal tunnel syndrome. The study also shows that 25% who working more than 20 years having a carpal tunnel syndrome. My research methodology is I started with the research design, followed by population and sampling. Sampling design consists of the sampling frame, technique and size. Then I will develop the instrument, data collections and data analysis. Research design will conduct a qualitative design using a questionnaire because it's most easy analysis and easy to get data. My target population is in staff in KPJ Seremban, which comprises from the healthcare providers such as nursing and allied health, uh, which is directly involved in delivering care. The distribution of the staff such as nursing management 23, trained staff is 279, non-trained staff 74, and allied health about 47. This is roughly the populations in KPJ Seremban. The sampling frame, as I mentioned above, is comprises of the senior managers, medical officer, nursing staff, and allied health. Sampling technique, we will select a random sample from each category. Estimated sample size for this study is about 25% from each category, which estimate about 107 sample for this study. Development of instrument. In the development process of instrument, which is questionnaire that we will use, will focusing on the demographic data, occupational health hazard experience, occupational health safety, policy implementations, what is the barrier and strategy in the improvement of the occupational safety and health. The data collections that contribute from the questionnaire will also collect within a time frame of 14 working days. We will distribute to the participants and collect the questionnaire. The data that we gain, we will convert it and analyze it using the SPSS. What I can conclude here, this proposal research is to conduct and assess a in-depth what is the most prevalence of the occupational health hazard in KPJ Seremban hospitals. Aim is to identify the most prevalence occupational health hazard and to analyze and establish the hazard prevention in reducing the risk of the occupational health hazard in KPJ Seremban. Thank you.